Hello and welcome. The first concept we'll look at in NUR 200 is the concept of cellular regulation. This PowerPoint will examine the concept of cellular regulation in general, and then we'll examine this concept as it relates to cancer and anemia. Please take the time to watch and listen to this PowerPoint prior to class. So for a minute, we're going to go back to anatomy and physiology. The cell is a self-contained unit and the basic unit of function for the body. The cell contains all of the operational hardware, much like the hard drive of a computer, in the form of DNA, which informs the cellular processes. Some of these processes include the cell's ability to self-regulate, generate energy, divide and grow, as well as processes for the end of a cell's life. Cells have their own metabolism and use glucose and oxygen for energy, as well as provide for oxygenation and provide for the metabolism of the body. Cells also have the ability to regulate and control how they divide, and when this ability is altered, an individual may experience disease related to unregulated cell division and differentiation. In broad terms, the concept of cellular regulation is defined as the cell's ability to divide, replicate, and differentiate into different functions dependent upon where the cells are located in the body. The first few pages of the chapter discuss the general characteristics of cells and cellular genetics, as well as the cell cycle, which will be important when we discuss cancer and how it is treated. The potential types of cell alterations that can occur in cellular regulation can occur as a cell is differentiating, or it can occur due to alterations to the cell cycle. By differentiating, I mean the cell becomes whatever it's meant to be. First off, I'm going to use red blood cells as an example. Red blood cell differentiation can be altered when there's a deficiency in the building blocks needed to develop a healthy cell, like iron, for example. No iron means your hemoglobin is not going to work. Therefore, the red blood cell is not going to be a correctly differentiated cell. Changes to bone marrow, where blood cells are made, can affect how red blood cells are manufactured and released as well. Hyperplasia is considered an increase in the number or density of normal cells. Causative factors for hyperplasia of cells include stress or metabolic demands. So this is an easy one if you think about somebody who's a weightlifter or if you've done any kind of weight training. As you continue to increase the amount of weight that you're lifting, you will develop hyperplasia of the muscle tissue. In other words, your muscles will become more toned and defined, and they may actually grow and get bigger. Metaplasia occurs when dividing cells differentiate into cell types that are not normally found in that part of the body. In other words, a metaplastic cell may occur normally somewhere else in the body, but not where it's currently found. Metaplasia may occur as a protective response to adverse conditions such as inflammation, and when the adverse condition stops, the metaplasia reverses. I also think of endometriosis, where endometrial tissue can be found at other places other than in the uterine lining where it's supposed to be. Dysplasia, I like to think as DNA gone wild. Dysplasia occurs when you have a loss of DNA control over differentiation, or differentiation has gone wild as a response to adverse conditions. Dysplastic cells are varied in size, shape, and appearance, and are not arranged in any type or manner. Often precancerous lesions may be referred to as dysplastic or dysplasias. Anaplasia occurs when a cell regresses to an immature, more undifferentiated cell type, usually due to something that happens during cell division. One of the things that we'll discuss with the exemplar of leukemia is that the cells that circulate through the body are immature or undifferentiated blood cells, which leads to an alteration in function. The exemplars that we'll be covering in NUR 200 related to cellular regulation are anemias and a variety of cancers, as is written here. I also need to add ovarian cancer to that list. It did not make the final cut. We will not be covering all of the cancers in 1 week, as there's just way too much content to cover. So you'll see that we will bridge cancer over the course of 2 weeks. One thing that you will find out about me very quickly is how much I like the interconnectedness of the concepts that we're studying. No matter what way I'm teaching, I get very excited to kind of bring everything and relate everything to one another, because that's kind of how the body works. Much as the body works as one whole system, the concepts we cover are all related to one another and are often threaded throughout the disease processes studied. You can't study anything in a vacuum because it all relates. The concepts that are listed as being related to cellular regulation are listed here. However, that's just to name a few. For fun, I went and looked at the concepts of our curriculum, and I think I got most of them as a connection to cellular regulation. So it is definitely a huge concept in terms of how it affects other areas of the body and other systems. One of the important things to examine with respect to disease processes is risk factors. Some of these are modifiable, meaning you can do something about it, and some of these are non-modifiable. Non-modifiable risk factors include things like age, gender, ethnicity, and family history. Genomics is a term used to describe the concept of passing traits to your offspring via your genetic material, also known as DNA. Specific cancers with a genetic component that have been defined include breast cancer, skin cancer, ovarian, colon, and prostate cancer. Genetics with respect to anemia depends on the type of anemia. For example, sickle cell anemia is an inherited recessive trait. Women can pass on a predisposition to having a heavy menstrual cycle, which can cause a blood loss anemia. Or you can pass on a lack of intrinsic factor, which will interfere with your body's absorption of vitamin B12. Other risk factors as related to cellular regulation are often related to lifestyle choice as well as the surrounding environment. Chronic diseases such as diabetes, hypertension, and hyperlipidemia are considered modifiable risk factors. Other modifiable risk factors include dietary, like the type of food that you're eating, nutritional, whether or not you've used sunscreen in the past, especially if you have a predisposition towards skin cancers, smoking, environmental, you have to think about radon in houses, living near a chemical plant, the air quality, and certainly if you've lived in Delaware any time, you know that Delaware's cancer rates have been notably higher, and some of them people have posited it back to the presence of industry within Delaware. Also, certain infections, for example, human papillomavirus, have been connected to the occurrence of certain cancers like cervical cancer. So when it comes to doing an assessment for the presence of alterations in cellular regulation, oftentimes it may start at a screening level. Screenings are very important based upon the presence of modifiable and non-modifiable risk factors. And it's very population specific, but you do know that at certain ages, women are encouraged to get mammograms. And at certain ages, everyone is encouraged to start receiving colonoscopies, as this is the most important way to screen for the presence of a disease at an earlier time. Your patient interview oftentimes will give you the first information that you need to determine what the patient, if the patient is experiencing an alteration in cellular regulation. And you look for the patient talking about 7 early warning signs of cancer, because that may be what they present with. I have a sore that doesn't heal. I've noticed that I've had a change in my bowel or bladder habits. So the CAUTION mnemonic is a very good way to start in terms of assessing and screening in community education. Physical assessment is going to be very specific to the alteration. You would want to do a general physical assessment, and then you would probably want to target your physical assessment to whatever alteration the patient is presenting with. With any type of alteration in cellular regulation, nutrition and hydration become very, very important key assessment findings. And it's important to include that into your physical assessment. Children and developmental assessments are going to be very important. Children will regress and experience delays in growth and development as it relates to certain types of cancers and even certain types of anemias. As you move forward through this curriculum, it's important to keep those developmental stages in mind and understand whether or not a child is demonstrating age-appropriate behavior. And no assessment is complete without considering psychosocial aspects of a diagnosis of disease. Many of these diseases, when diagnosed, bring with them major psychosocial implications. Some of the nursing care that you provide will be related to collaboration between you and other providers, but some of the interventions that you will implement as a nurse will be unrelated to a consult or a doctor's order. Never underestimate the value psychosocial support plays with respect to assist the client with diagnosis and healing. As a nurse, you are the one who spends the most time with the patients, and therefore you have the ability to provide the biggest impact. Psychosocial support involves allowing the client time to adapt to a new reality, providing education about what to expect and where to find resources, and also to listen. Some of my best moments in nursing have been when I've pulled up a chair by the patient's bedside and just listened. It means a lot more for them than you will ever know, and often means more than any fancy procedure you can do. Sometimes psychosocial support involves promoting healthy grieving. If you ever want to talk to a hospice nurse about the grieving process, you're going to get a wealth of information because hospice nurses are consistently assisting clients with how to grieve, either loss of function of a body part or loss of life itself. There are a lot of considerations when providing care for a pediatric client who has an alteration in cellular regulation. Interventions for support will relate once again to the developmental stage the child is in. Younger children will have fear and may not be able to understand the pain related to procedures, and older children may need social support and may need support for grief issues as well. Family and siblings of the client with alterations in cellular regulation will require support and education, as an ill child will disrupt the family processes. Nutritional interventions may involve nutritional assessments, calorie counts, assessing a client's appetite, and advocating for the client with respect to dietary preferences. Nurses are also caregivers who will be promoting a balance between activity and rest, which is pivotal in clients with cellular regulation disorders. Now that we've looked at cellular regulation as a concept, and we've examined nursing interventions, now we can look at collaborative concerns and therapies. Pharmacologic therapy will be covered as it relates to each exemplar, but it's a pivotal collaborative intervention in the treatment of disorders of cellular regulation. And there's a ton of pharmacology involved with, especially cancer treatment. Radiation therapy is used for treatment of some disorders, and there's a specific nursing care related to it. One of our classroom activities will directly reflect some of the nursing care you need to worry about with radiation therapies. Many treatments also have very unpleasant side effects, which involve a collaborative effort to treat, including the areas of nutrition and hydration. There's areas of surgical treatments as well, and that involves going in and surgically removing the area that's causing the problem. Please stay tuned for part 2 of this presentation.